What do you do if a patient refuses therapy? And we're back, Vlogmas day number 3. We are cruising right along. I have my Mr. Claus down here. We're gonna jump right in to the question. What is it gonna be? Also forgot to say I have the power to veto any of these questions. If I don't like them, I change my mind. But let's see what the topic of discussion is today. What do you do if a patient refuses therapy? Great question. I'm glad you asked. Actually, I wrote this question because I thought it would be an interesting topic. But hey everyone, if you're new here, my name's Arwen. I'm an OT, and it's Vlogmas. And I just got off of work, and I came home and immediately shoved a lot of food into my mouth. We're gonna tackle a new question today. I think someone actually might have asked me this in the comments. I'm not sure. I'm actually loving your comments. Actually, hold on really quick. Okay, we're back. Really quick, I just wanted to shout out EVPL and Carrie Ann and Zach. Thank you, Zach. Zach is a MOT student, and he's a male, so thank you for commenting, Zach. I hope everything's going good in OT school. And Jim's 10-1. She commented yesterday about, females not wanting to work with male patients, and I completely agree. That is, that can be a problem. But thank you all for commenting. I really appreciate it. I really like having a discussion with y'all. But on to today's topic. What do you do if a patient refuses therapy? There's really not much you can do except for document it. In the setting that I work in, so working with children and their families and doing home health, I would say most of the time families don't decline therapy. Usually if they're referred, they have made the referral themselves, or they're aware of the referral and they actually want to be seeking help for their child. So most of the time I don't experience a lot of resistance in beginning treatment or beginning therapy. We do have some families that disagree with our recommendations, or we evaluate children that are seen by CPS, and sometimes CPS will make a referral and the child actually does have delays. Many of the times CPS referrals don't have delays, but sometimes those parents can disagree with our recommendations. But most of the time I don't experience refusals. Where it gets complicated is when you work in acute care, when you work in inpatient rehab, when you work in a SNF, so a skilled nursing facility. That's where you see a lot more refusals. When I did my field work rotation in acute care, there are many times where you walk in the room and you say, hello, my name is Arwen, I'm gonna be your OT, this is what we're gonna work on today. And they pretty much don't want to get out of bed, and you have to work some magic and build a relationship and try and get them to want to participate in activities, but sometimes they don't want to. And you document that you attempted to treat, you document their response, that patient refused or patient declined at bedside. Just document what happened, and that's really all you can do. People are allowed to decline medical care at any time. People decline medical procedures that could save their life, so it's completely in their right to decline therapy at any time. But I think this kind of goes back in relationship to yesterday, and I got a lot of cancellations yesterday, and that's not really a refusal for therapy or declining therapy, but it's kind of in the same boat of, in order to get paid, we do need to treat clients, and if they're refusing or they're canceling because of other reasons, that does add up. Luckily, like I said, I don't experience this a lot. It's usually in other settings, like working in a hospital, working in a skilled nursing. Inpatient rehab can be so-so. Working in nursing homes and skilled nursing facilities, a lot of the times older patients have a hard time being motivated, and that can be really difficult. So those patients tend to refuse or decline therapy more often than maybe our younger clientele. But I do want to say, just because a client declines on one day doesn't mean I'm not going to go back the next day or even maybe later in the day. That doesn't mean that I'm going to give up completely on this person, on this individual, and say, oh no, they don't want therapy. Just gonna give up on them. No, I'm gonna keep going back and keep trying to build a relationship and try and find out what motivates them, what is important to them. And I think that's what's so special about OT, is that we're pretty good at figuring out what is meaningful in someone's life and then trying to use that during our therapeutic activities. Just because someone declines one day does not mean I'm never going to call them back or never attempt to schedule them again. Same as in working in acute care, you know, I might say, hey, you know, I know you're not feeling up to it right now, but I'm going to come back in the afternoon after lunch. Or maybe I will come back at lunch and maybe I can help you sit up at the bedside and eat your food. It might feel good to like sit up and eat. And they'll be like, oh yeah, it might feel kind of good to get out of this bed for a second. And so you just have to kind of find those sneaky little ways to make them not think that they're doing therapy when really what we're doing is very therapeutic. They just don't realize it. Going back to cancellations, some facilities have really strict cancellation policies and attendance policies, and they will kick you out. They'll kick you to the curb if you miss so many therapy visits in a row or you're a frequent canceller. We do not have one of those policies. Sometimes I wish we did, but again, if the family or the client is not really taking therapy seriously, then it's kind of a waste of their time and our time, and we could be filling that spot with someone who actually does want to get better or does really want to benefit from therapy. That was actually a great question. I think I answered it pretty quickly. Catching up on what I did today. Today was a very successful day. I was able to see all 7 of my scheduled kiddos. It was a mixture, oven's ready. It was a mixture of hour-long visits, 45-minute long visits, and then a little bit of case management and therapy plan and therapy goal updates. So very happy that everyone was able to be seen today. I would say today was very productive, definitely the opposite of yesterday. So yeah, I think that's gonna be it for today. Really quick, short video. Hopefully we'll see how much I actually rambled on today. I will be back tomorrow. Tomorrow is Wednesday. My 8:30 canceled, they're out of town. I have yet to fill it. And then my 10 o'clock, I wish I could share some of these details with you, but I cannot because of privacy protection laws. But I just have some really interesting families, some really interesting cultural differences that I've been actually really enjoying. I wish I could share more, but I'll be back tomorrow with another OT question of the day with Mr. Claus. He's my buddy now. What is it gonna be? I don't know. We'll have to see. Okay, I'll see you tomorrow. Bye.